In the last video in this module, I'll be discussing schizophrenia spectrum disorders. Schizophrenia is a psychological disorder that is characterized by major disturbances in thought, perception, emotion, and behavior. The hallmark of schizophrenia is psychosis, which is a mental state where the person has difficulty distinguishing reality from what is not real. Compared to other disorders, schizophrenia is relatively rare. The lifetime prevalence in the US is only about 1%. The disorder can onset at any age, but it is most commonly first identified during early adulthood in the person's early to mid-20s. The symptoms of schizophrenia are wide-ranging, affecting a person's thoughts, emotions, and behaviors. They are usually grouped into two major categories: positive symptoms and negative symptoms. Do you remember in Module 5 when we covered operant conditioning and learned about positive and negative reinforcement? Recall that positive and negative did not mean good or bad, but simply denoted whether something was added or taken away. It's the same thing here. The positive symptoms of schizophrenia reflect the addition of odd thoughts or behaviors that are not normally present, including hallucinations, delusions, and disorganized thinking. The negative symptoms of schizophrenia reflect the subtraction of things that are normally present, such as reduced or flattened affect and social withdrawal. Let's begin by talking more about some of the positive symptoms of schizophrenia. First, hallucinations are perceptual experiences that occur in the absence of external stimulation. In schizophrenia, the most common form of hallucinations is auditory, usually in the form of hearing voices, but hallucinations can present with any of the five senses. Whereas hallucinations involve false perceptual experiences, delusions involve false cognitive beliefs. Delusions are beliefs that are contrary to reality and are firmly held even in the face of contradictory evidence. This is more than simply being mistaken. Delusional beliefs are clearly absurd, such as believing that your neighbor is an enemy spy who is plotting to kill you, or that you are the reincarnation of Elvis. There are three general categories of delusional beliefs: paranoid, grandiose, and somatic. Paranoid delusions involve the false belief that people or agencies are plotting to harm the person, such as the example where you are convinced that your neighbor is an enemy spy. People with paranoid delusions also frequently believe that they are being watched or that their thoughts are being monitored by government agencies, such as the FBI or CIA. Grandiose delusions involve the false belief that one holds special power, unique knowledge, or is extremely important. Again, this goes beyond simply being arrogant. Someone with a grandiose delusion believes something obviously untrue, such as that they are very famous, when they are not famous at all, or that they can wield special supernatural powers. A final category is somatic delusions, which involve believing that something highly abnormal is happening with your body, such as that you are infested with insects. In addition to hallucinations and delusions, people with schizophrenia also frequently experience disjointed and incoherent thought processes. These disturbances in thought are often revealed in a person's speech. For example, the person might have difficulty holding on to a single train of thought during a conversation, instead quickly jumping to only marginally related topics. For example, if asked about receiving special job training, a person with schizophrenia might state that they once rode on a train somewhere. Although to us these two topics are pretty unrelated, to the person with schizophrenia, the connection between job training and riding on a train is sufficient. On the extreme end, a person with schizophrenia might exhibit something called word salad, which is when the person talks in a way that is so disorganized and incomprehensible that it seems as though they are randomly combining words. A final positive symptom of schizophrenia involves disturbances in motor behavior. For example, the person may become unusually active, display odd facial expressions or gestures, or exhibit silly childlike behaviors such as giggling or self-absorbed smiling. In some cases, the person may exhibit catatonic behaviors, in which the person maintains a rigid and bizarre posture for long periods of time. Moving on to the negative symptoms of schizophrenia. Remember, these are things that are absent in a person with schizophrenia, but normally should be present. These include things like a lack of emotional expression, anhedonia, which is a lack of pleasure, avolition, which is a lack of initiative or motivation, and asociality, or social withdrawal. As a quick note, most of these words start with A because A is a root meaning without, so asociality, for example, means a lack of sociality. As you can see, the symptoms of schizophrenia can be fairly severe. Many people with schizophrenia experience significant difficulties in a number of day-to-day activities, and hospitalization is not uncommon, even with the best treatment and medication. However, it's also untrue that people with schizophrenia cannot lead full, productive lives. For example, Dr. Ellen Sachs is a highly successful researcher and professor living with schizophrenia. You can learn more about her story by watching the supplemental video on Canvas. Although schizophrenia is the primary disorder that comes to mind when we discuss psychotic disorders, there are in fact a group of disorders that all share some characteristics with schizophrenia, and these are collectively called schizophrenia spectrum disorders. Other schizophrenia spectrum disorders include schizoaffective disorder, which is a combination of schizophrenia and/or depression and mania, brief psychotic disorder, which is when a person experiences psychotic symptoms for only a few days or weeks, and delusional disorder, which is when a person only experiences delusions but not the other symptoms of schizophrenia. We're not covering personality disorders in this module, but there are also 2 personality disorders in which people display some schizophrenia-like behaviors. First, schizoid personality disorder has overlap with some of the negative but not positive symptoms of schizophrenia. Specifically, schizoid personality disorder is marked by extreme social withdrawal. This is not due to shyness or anxiety. They are genuinely disinterested in other people. People with schizoid personality disorder may also show flattened affect and reduced capacity for emotional expression. Next, people with schizotypal personality disorder display odd patterns of thinking and behaving, but not to the level that it would rise to a schizophrenia diagnosis. For example, they may dress in an eccentric or unkempt way, their speech might ramble, or they may use odd phrases, or they may have unusual thoughts, such as magical thinking. Schizotypal personality disorder is also frequently comorbid with social anxiety, as people with schizotypal personality disorder may have difficulty understanding social cues or responding appropriately in social situations. What causes someone to develop schizophrenia spectrum disorders? Like the other psychological disorders that we've discussed so far, the causes are likely complex and are still not fully understood. However, there is considerable evidence that schizophrenia has a strong genetic basis. For example, the risk of developing schizophrenia is nearly 6 times greater if one has a parent with schizophrenia than if one does not. Given this, it would make sense for there to be biological correlates of schizophrenia, and indeed there is good evidence that the neurotransmitter dopamine may be strongly implicated in schizophrenia symptoms. Specifically, schizophrenia is associated with an overabundance of dopamine activity. Many of the current medications used to treat schizophrenia are dopamine antagonists, which means that they decrease the amount and activity of dopamine in certain regions of the brain. On the flip side, drugs that increase dopamine activity can sometimes actually produce schizophrenia-like symptoms, like hallucinations. Other recent research has focused on another neurotransmitter, glutamate, which shows decreased activity in people with schizophrenia. However, these 2 potential explanations, glutamate and dopamine, might in fact be complementary because glutamate plays a major role in regulating dopamine neurons. While schizophrenia does appear to have a strong genetic and biological basis, there can be environmental risk factors as well. In particular, several lines of evidence have shown a correlation between marijuana use and schizophrenia symptoms, and longitudinal studies suggest that heavy marijuana use may play a causal role in leading to the onset of schizophrenia. In this video, I discussed schizophrenia spectrum disorders. For the exam, you should be able to describe the positive and negative symptoms of schizophrenia and distinguish between them, identify the different schizophrenia spectrum disorders in an example description, and discuss the potential biological and environmental causes of schizophrenia.